Dr. Speed at Trophy Club Animal Hospital. Today I wanted to talk to you about common standard of care items that we recommend and also require for our drop-off patients here at Trophy Club Animal Hospital. Our standard of care items here in Trophy Club, Texas may not match those in California or New York, or depending on zoning and certainly risk benefits of diseases versus vaccination in your area. So Trophy Club has Lake Grapevine nearby, Marshall Creek, so that kind of exposes us to something that other parts of the world doesn't have, which is leptospirosis. So that is one of the vaccines that we require for our patients to have if they're going to board, be groomed, or stay in our hospital unless they're in the sick side of the hospital. Obviously, we don't vaccinate sick dogs. We keep them in isolation if they're not protected. Leptospirosis is an infectious organism that lives in water sources. It is spread from wild animal urine. It also is spread from infected animals' urine, so your cat or dog, and it can infect people. So this is a vaccine that we do require at Trophy Club Animal Hospital. Other canine vaccines that are required is your distemper parvo vaccine. These are common respiratory viruses and GI viruses that canines get. They can get it from aerosolization or from your clothes. So this is something that we do require. At Trophy Club Animal Hospital, we do not require that vaccine on an annual basis. If your pet is vaccinated appropriately, we will label it as a 3-year vaccine so that they aren't having to be over-vaccinated, but yet are protected. Another vaccine that is required is the rabies vaccine. This vaccine is required by law. Texas has recently, within the last several years, allowed rabies to be a 3-year vaccine pending it was boosted appropriately, administered as a puppy at year 1, and then it becomes a 3-year vaccine, which is wonderful so that we can cut down on the vaccine stimulation we're putting in our canines' bodies. And then the last vaccine we require at Trophy Club Animal Hospital is Bordetella. This helps prevent kennel cough and certainly major symptoms developed from kennel cough. We at Trophy Club Animal Hospital only require Bordetella every year. There are lots of boarding and grooming facilities in the area that require it every 6 months. We do have a reminder system for 6 months for those people that use services elsewhere to help keep their pets protected. Doing Bordetella every 6 months is not wrong. It's just statistically not necessary. Of course, if you're keeping your dog in a boarding facility with 177 animals at a night, their exposure is a lot higher, and people are concerned that vaccines aren't given time to actually create stimulation. That's why they're doing the 6-month vaccines there. So those are the 4 vaccines that are required in our canine patients at Trophy Club Animal Hospital. Other standard of care items that we require that you may not see at other facilities, and this is just to basically protect the integrity of our hospital and yard, and also to keep your pets safe, is an annual fecal test, and this is to ensure their pets don't have intestinal parasites that can both be infectious to people and other animals. And if the fecal test is negative, we do an annual dewormer, an annual broad spectrum dewormer. The deworming that the CDC recommends, they recommend it every 6 to 12 months in your canine patients. We at Trophy Club Animal Hospital require it every 12 months, primarily because most of our patients are on monthly heartworm prevention, which also helps cut down on intestinal parasite burdens. That does cover everything that we require for our canine patients. One more. Flea prevention. Flea prevention is something that we require our boarding and drop-off patients to be on. If your pet is not on a vet-prescribed flea prevention, we do offer a Capstar that day, and it's a $3 and some change. It's a pill that kills fleas for 24 hours. This basically protects your pet from going home with fleas and also protects our hospital from your pet bringing fleas in. We require vet-prescribed flea prevention because there is a lot of flea resistance out there, and as drugs lose their patents, other kind of forms are made that aren't as good, that aren't actually killing the fleas but causing flea resistance or superbugs. And the last thing we want is our patients to come healthy and leave with a problem such as fleas. Other things that we offer or recommend but do not require is a heartworm test and heartworm prevention. This certainly is in the best interest of your pet, but not required for them to board or stay in our facility. If you have questions or wonder, hey, why do we do this, then please, by all means, call, comment, and we're happy to discuss further. Happy Wednesday.